here in Manhasset, Long Island, as a participant in the North Shore Long Island Jewish Nursing Education Conference. The theme of the conference this year is Preparing the Next Generation of Nurses, the Organizational and Academic Perspective. They have some fantastic presenters, and it's a collaboration between hospital-based educators and, of course, those educators that are in the academic facilities or academic sites in the greater New York area. I'm really looking to hearing about the collaborations and some of the new ways of reaching nursing students, but also collaborating with the organizations in that smooth transition. There's also going to be speakers that are going to be talking about academic preparation through the career of a nurse from baccalaureate all the way through a DNS. So it should be very exciting. So I'm standing here with Dr. Kevel Fredrickson, and she is a professor at Pace University, celebrating 50 plus years of nursing. Could you please share with us, after 50 plus years of nursing, what are you doing getting continuing education credits?
I love nursing. Nursing has been so good to me. I have done everything from children's feet to adults' heads. I've done continuing ed, I've done clinical nursing, I started in rehab. I've been in the neuro ICU for peds. I've been in the Eye Institute, and I've taught at Pace. I've taught at NYU, I've taught at Columbia, I've taught at Teachers College, I've taught in Monterrey, Mexico, and I've done some teaching in Australia. So I could not be happier with this profession. And as my husband says, you know what, dear? You're not 100, so you got 28 more years to go.
So with all of that, all right, I am sure then you are a proponent of lifelong learning?
Oh, there's no other way. I can't imagine any other way. Some people talk about their grandchildren, which I have, and I do talk about them, but I'm much more interested in my students and my research. And my husband, you have to put your priorities straight.
Okay, so if there was one topic, just one topic of research that you would like to share or at least encourage some of our fledgling nurses out there that are in postgraduate programs struggling with a topic, what would you encourage?
I would say go with your passion, whatever you're really interested in, because if you pick a topic that seems convenient, well, let me tell you, you will get bored before you know it. But your passion is something that will take you all the way through. And the way you can find your passion is you start reading and you talk to people, talk to other nurses, talk to patients. Find out how your passion fits with their needs.
So I am with one of the program planners, okay? Donna Tanzi is a doctoral candidate. She is one of the program planners. Donna, were you chairing this year?
Yes, this year I chaired.
So Donna was the chair of this program, and I want to speak to Donna because her hospital is a magnet-designated hospital. I wanted to speak to her about the role of education, nursing education, in achieving magnet status. Donna.
So, thanks, Phyllis. So, really, nursing education is at the core of the entire magnet process. Everything that's related to outcomes is related in some way to some sort of educational program. Magnet looks to see what our nurse satisfaction is on their opportunities for professional advancement, educational advancement. They also look to see how education is threaded through the whole process of all our processes and structures as we get and guide towards our outcomes. So it's really a key component to any hospital that's on that journey for magnet. They need to have a strong, significant nursing education department.
Okay, well, thank you, and congratulations to Huntington Hospital being magnet now for how many times?
3 times. We're going for our 4th next year.
Well, you go, girl. Wonderful. Okay, so here we are during the poster presentation of the conference, and I am going to be speaking with Jeanette Bredis and Maureen John, and they are from New York Huntington. Their presentation is on Get Smart Program Cardiac Service Team, and I'm going to ask them to walk us through their poster. Ladies?
Thank you. This is our program that we have for the cardiac service line. What it is we have a continuous culture of lifelong learning here at Huntington Hospital in the Cath Lab, EPS Lab. We provide 2 sessions every month 1-hour sessions where we close the lab and provide education to a multidisciplinary team. With that team, we have experts in the field that have subject matter that they want to teach. So we teach the courses. So it's all about physicians teaching, nurse practitioners, the staff themselves, techs, supply representatives. We did a needs assessment, and they determine what you want to teach, but it all correlates to our patients in terms of the education that we need to provide them to make them satisfied with the education we're providing. And it all shows over, since 2012, information the day of surgery. We have a little work to do in 2015. Information given your family during the procedure is going up year after year. And instructions regarding home care. Going up, still got some work to do in 2015. This is what we're really happy about. Maureen, maybe you can speak to it.
Maureen, you want to talk about the RN satisfaction results?
Yes, we've concluded that the nurses have really appreciated and liked the education series. It began about 3 or 4 years ago. It was very slowly, it started, it was every other month, it's now bi-monthly. The staff participates themselves, and it has showed in the satisfaction surveys that they appreciate that the hospital has
Invested
the time for us to learn. We work in cardiac services. There are 2 separate factions, electrophysiology and the cardiac cath lab. And the nurses, there are separate nurses for each, but we join in one area, and these sessions help us to learn each other's role when we are taking care of each other's patients, and it increases the education that we give our patients.
So you're essentially breaking down those barriers, really putting the patient at the center of everything that you're doing. Okay, and ladies and gentlemen, this is why, Huntington Hospital's going for magnet number 4. Congratulations, lady.
Thank you very much.
So we have a wonderful poster here from Adelphi University, and it is offered by nursing student Elizabeth Sam, and Miss Sam was advised by Dr. Louise Geddes and Dr. Ambrosio. Very good. Okay, and what I love about this is it's so patient-centered, improving nursing care for the transgender population through baccalaureate education and clinical practice. So, Elizabeth, congratulations on a wonderful poster. Can you walk me through how you came to develop this?
Absolutely. So the idea for this poster really came a couple years ago when I was sitting through my first psych class. And when I was sitting there was a student who made a remark that transgender patients had a mental disorder because of their gender identity. So I wondered why there was this conflation between being transgender and having a mental disorder, and why that was. So my research really started to focus on why nursing education hasn't really addressed that. And when I examined my own education and what sort of courses that my own school implemented and what I've been doing, I realized there wasn't much focus on gender studies or anything that really talked about what gender identity meant. So I think that really informs a lot of why there is some discrimination and some more so misunderstanding, I would say. So my research really looks to address that issue, and it brings forth 2 different possible solutions. So one is nursing education in the sense that in the classroom setting. So really going into the prerequisite courses, seeing where we can make improvements, implementing more gender and sexuality courses. At the core of it, it's to really make nursing students understand that there is that what gender identity means and what it really means for patients. And then in clinical practice, what do you do when you have a transgender patient come in? How do you assess? How do you do the practical side of things? So apart from that, I mean, ultimately my aim is to really bring some more light on this issue because it's not really talked about as much. But I'm really hoping it will make a big difference someday.
I can't imagine that it wouldn't make a big difference, and I'm just so impressed that here you are, an undergraduate student, and you're taking on something that is obviously, I would consider mainstream and not not discussed enough. And I'm just so proud of you.
Oh, thank you
I'm
so much.
proud of you. It really gives me a lot of hope for future nurses like yourself to be very patient-centered and really start from where the patient's at, regardless of your ethnic or cultural background or belief system. You put that all in your locker and you go and do your nursing.
Thank you so much.
Congratulations.
I really hope it'll become something.
Okay, wonderful.
Thank you.
Really wonderful. So I am here with Alicia Stone, and she is a PhD candidate, and I am so impressed by this poster, and it is speaking my language, the impact of blogging on nursing student engagement in the classroom, and this is offered by Malloy College. Hi, Alicia.
Hi, how are you?
You want to walk us through your poster, please?
So basically, I did a study on how pre-class blogging on clinical scenarios and using clinical reasoning would impact student engagement in the classroom.
Okay.
So we separated the groups into 3 controlled, 3 intervention, and the 3 intervention groups actually got a pre-class blogging assignment that's here, and there were several offered to the instructors to choose from, and then they did it 5 times, and then we tested them with this instrument before and after, so it's a pre and post intervention study.
Okay.
And on a quantitative approach. We characterized what was in the classes, and then we looked at whether or not there was a change in the level of engagement. Unfortunately, there wasn't a statistical significance, but the instructors found that blogging did change the way that they were approaching the material and their understanding of it.
Well, you have to start the research somewhere. Okay,
yes.
so
And no finding is a finding. So
no finding is a finding, and I'm sure you learned a lot, to build on that.
Yes.
What I'm impressed is that you're actually, making a wonderful attempt here to meet our millennium students where they live.
Well, the next generation are more comfortable online, but they still want that face-to-face learning. That's what I found, and they like to work in groups. So the action of blogging with the responding back and forth leads them to learn together, and
Right.
that's the important part of the whole
Excellent.
situation.
Congratulations.
Thank you so much.